The problems that I commonly see in the lung clinic are things like chronic obstructive pulmonary disease, asthma, lung cancer, and then rarer lung diseases like inflammatory lung diseases. One thing that we do on a regular basis is pulmonary function testing. So that's basically a procedure where people blow out into a tube and a computer analyzes their lung capacity. So we can look at how much lung capacity they have versus how much they should have. That's one of the ways we diagnose things like chronic obstructive pulmonary disease. It's one of the ways we diagnose the fibrotic or scarring lung diseases like pulmonary fibrosis. So that's one of the ways we have looking at the lungs. Obviously pictures, so in the form of chest x-rays or CAT scans or PET scans, those are different imaging ways to look at the lungs. One of the common ways or common procedures that lung doctors use to investigate the lungs is called bronchoscopy. And this is a procedure that's usually done without patients. People go to an endoscopy suite that really looks kind of like an operating room. They have an IV started. They receive medicines. It's what we call conscious sedation or moderate sedation. It's usually not general anesthesia, so they're not completely out of it. But it's not a painful procedure. People generally don't remember the procedure. Once they're sedated or relaxed, we will introduce a bronchoscope, which is basically a thin tube with a light on the end of it, through either their nose or the mouth, and look down into the lungs. We have a bronchoscope that has a little ultrasound at the bottom of it. So we can go down into somebody's lungs, look through the bronchial tube, which allows us to guide our biopsies and direct our biopsies much more specifically than in the past. Another new technology that we're using here is called Navigational Bronchoscopy. So when we get out to the edges of the lungs, we have trouble seeing the problem. And so there's a technique called Navigational Bronchoscopy where we use a GPS-like system to kind of drive us out there to the edge of the lungs and get much more accurate biopsies out in the edges. So recovery from bronchoscopy is usually pretty straightforward. If biopsies are taken, sometimes we'll take a chest x-ray to make sure that there's been no damage done to the lungs. Usually people are up an hour or two after the procedure and they're able to go home at that point. So in addition to being useful for diagnosing various lung conditions, bronchoscopy is increasingly being used to treat various lung conditions. So for example, in chronic obstructive pulmonary disease, part of the problem is that the lungs are what we call hyperinflated. Air gets trapped in the lungs, which make it harder for people to breathe. And so there are techniques being developed to help deflate the lungs a little bit, to help people breathe easier. The other condition where we're starting to use bronchoscopy is in asthma. You know, the best medicines for asthma are what we call controller medicines, and this is traditionally included mostly inhaled steroids. But there are some people that are not controlled even on the best medicines we have available. And so thermoplasty is a technique where you go down into the lungs and use gentle heat to heat the airways, and this decreases the amount of muscle and constriction in the airways, and people actually have less asthma symptoms, including less wheezing, less cough, and less shortness of breath.